We had a patient who was in Dubai. Raise your hand. All right. So we had a patient, and it's like the problem of an academy and demonstration in events that you don't really see the follow-up. So you have to just believe me. So that's what we try to do in successive academies, to show you what happened. So there was an hypopigmented, a little bit elevated scar. We treated the scar. Do I have the setting? No. We treated the scar. I'll show it again so you can see. So this was the end of the treatment. Let's see if, all right. You see, this is a 2-to-1 pattern. Okay, I recognize, I do not remember. And then feathering with the brush mode all over the scar. And this is before, and this is now. Now, this wasn't the only treatment. I would say maybe a little bit too many treatment. I would probably use less treatment and more interval. But since last year, she went through 7 treatments. Okay, and I would like to invite her to the stage because she's here. Who is it's Anna. Anna, right? I remember. Anna. So thank you so much for coming. And so this is before, and you can see how are you? You can see the changes. And I would like to talk about the changes, and I would like to tell you how we could have done better. Okay, we always have to improve. There are 4 results in aesthetic, I would say, medicine, not just in scars. The one in which, are you happy?
I'm very happy.
I'm very happy too. Is it good? No, you're not good. Okay. The second one, are you happy? Say no.
No.
No, I'm not happy. It's a good result in aesthetic medicine. So we agree that we are both not happy, okay, and we have to do something. Now, another result is, are you happy? Say no.
Not yet.
Not yet, or I don't see any result. I said, oh, come on, have a look, the dramatic result. This is a problem. I don't know, maybe it's a problem with the patient or with the physician. I think the best result is always to question you. Are you happy? Now say the truth.
Yes.
Yes.
It's improved a lot.
I'm not happy.
Yeah.
I think how I would do it better. So let's see how we do it better. What are the main changes? Let's ask you.
Yeah.
Because you live with the scar. You look at the mirror, this is the change. If you compare to last year, can you, elaborate, what do you feel? What are the main changes in the scar tissue?
Good morning, everyone. First of all, it's a pleasure to be here with all our KOLs, Alma team, and our guests. So, yeah, I wanted to share a little bit more about this scar. I got this scar when I was younger. It's about 20 years already I have this scar. And it was affecting my life. I think I was avoiding wearing sleeveless clothes, definitely, and I was looking for a solution.
Could you put makeup back then?
No, I was not using the makeup. I think I was just hiding this scar because I saw how people look at this scar, right? Not intentionally maybe, but it was quite visible. And last year in Alma Academy, you performed my first treatment, and after 1 month, I was very happy because the texture became more uniform. When I touch my scar
before, you can see the change of texture.
I felt it, and now I don't feel it. If I can show it, I think it's better by reality than on the picture.
Hug her at dinner, and then, all right? Okay, so you see it's flat.
Yes,
the texture is very nice.
And the visibility. I think now I'm quite confidently can wear sleeveless clothes. For sure, there is a room for improvement, but I
so
already
let's talk
can
about the
say
improvement. Which component we didn't succeed to improve? The color, the hypopigmentation. All right, now please give me some offers. What should have been done during the year in order for her to stand here in a different, I would say, better condition? Do you have any, just raise your hand. No, nothing? Do you know, for example, for vitiligo, which laser is used? Oh, sorry, I didn't see it. All right, so drugs. For example, bimatopost, it's prostaglandin agonist. You apply it, it really restores color. So this was probably, it had to be done during the year in order to get to a better place. One. Second, laser, I already said. Yeah, excimer, laser, just to come during the treatment 2 to 3 times a week for excimer. Or if we do not have budget, there is a concept which is called induced hyperpigmentation. What do you tell your patient? You perform the treatment, right? And then you tell them, avoid sun, right? Because of the risk of hyperpigmentation. So here we want to intentionally, so intentional induced hyperpigmentation. So we do the treatment, we tell her, cover the surrounding and goes to the sun. I don't want you to burn yourself by twice a week. You live in Dubai. Come
it's
on.
not very
Beautiful
difficult.
Dubai. All right. So twice a week, 10 minutes, it will make a huge change. All right. But again, you can see the improvement.
And in fact, I don't have any more hyperpigmentation. Yes, it's
No,
gone.
but you have a little bit, so it's like if you see, there is a little bit, the texture is very, very nice, but you have a little bit of whitish, and this can be improved unless you are okay with it. Thank you so
Thank you so
much.
much, Dr.
We have to rush to the demonstration, so I will call Sharon and I will call the patient. Do you have any questions so far till the patient is reaching the stage? Okay, so just to understand, how many of you have the Alma hybrid system? Just raise your hand. Oh, Alma team. That's it? All right, this is kind of, I think, and again, I'm not talking on behalf of the company. Twice a week, I have a physician calling me, asking me for what is the first device that I should buy, okay? So this is like plastic surgeons, derms. I wouldn't buy hybrid as a first device, yeah? The first device should be a platform in which you have IPL. Which system? The cheapest one, but don't buy the cheapest, because the cheapest would not provide and it will break. But buy a platform in which you have IPL and some other, I would say, possibilities. Non-ablative fractional laser, the more handpieces, and of course, the cheaper the device and with good company, this is okay. This is the first device. The second device, it's the Alma hybrid. Because for so many indications, this is the second device to be bought, okay? For scars, for rejuvenation, for male, for female, for Caucasian, this is the second device. And then it depends what you do. Let's say if you treat mostly vascular lesions, probably I will buy pulse dye laser and some, okay? If you are, you do just pigmentation and tattoos, you have to have picosecond laser, okay? But these are the two devices that this is the beginning. All right, so we have a patient. How are you, our patient? You look crucified. All right, so what is your name?
Yolanda.
Yolanda. So we had Anna, and now it's Yolanda. And Yolanda, as you can see, this is a very common complication of the removal of excess skin. Okay? Unfortunately, these procedures scar, and I'm talking about the excess skin of the lower abdomen and the medial scars. It's always a scar. So I would like to really start. Don't be shy. Whenever you look at such scar, Yolanda, I promise not to harm you. Okay, have a look. Do you see? Because I don't see the screen. So first, I look at the scar as if it was a picture. What do you see? I'm asking you. Please describe me. Which components should be addressed in this scar? Let's, and raise your hand. Who see redness? Good, you're not blind. Who see hypertrophy? Good, you're not blind. You woke up. You didn't drink a lot yesterday night. This night, we're not forgive you if you're not drunk. Okay? So, the two main components of these scars, and we have it bilaterally, it's vascular component and hypertrophic component, okay? So let's talk about the vascular component. Always vascular and pigmented component should be treated first. You can do it in different sessions, or you can do it in the same session, but if it's the same session, it should be performed first. So which laser can be used here? You know, you're not going to talk about company. Which wavelength? Let's say, who is going to use 694 nanometer ruby laser for this indication? I'm preparing my gun. Okay, good. Yeah, all right, this is a pigmented laser, clear. The absorption, the chromophore is pigment. Who will use 532? Okay, good answer, not the best one. Good answer. Who is going to use 577? Okay, so you're not familiar with the laser, great laser for this indication. 595, pulse dye laser. Who is going to use IPL for this indication? IPL does greatly in this indication. Probably if she was my patient, because I have all the wavelengths, so I would use pulse dye laser. However, I'm not sure IPL is inferior. You have to do the pulse duration as short as possible. So with the DiVL, it's 10, and I told you, go low, really low. So we couldn't bring the IPL here because we didn't want to blind you. So what have you done? Can you elaborate? Yeah, I'll come closer to you.
We used the DiVL applicator on the Harmony XL Pro. We used a fluence of 5, pulse width of 10 milliseconds, and we did 2 passes, stationary up the whole scar. We did that at around 9 o'clock, so just an hour.
Do we have maybe the treatment?
Yeah, we're
All
going
right.
to show the protocol.
All right. So we're going to show that. All right. So there is the protocol. Cool. So you can see this is the protocol. So low fluence, short pulse duration. Again, this is the shortest. If I had shorter, I would use shorter, but this is what we have. 2 passes. It's better to go low. Now the second phase, I would like to treat the hypertrophy. Now, you have to think or to understand how I think. If I have a very thick hypertrophic scar, I would inject. Thick, it means above 2 millimeter. If it's less than 2 millimeter, if I inject, the chances of having uneven skin, high atrophy, lipodystrophy is too high, telangiectasia. So I do not inject. This is one point to mention. The second one, which is important, is how to inject and what to inject. Triamcinolone, there are many studies, mainly for keloids, but for hypertrophic scars, that compare triamcinolone first, this is a study by Jill Weibel from Miami, to 5-FU. Which one is better for hypertrophic scars? They're the same, but less adverse effect for 5-FU, okay? Less telangiectasia, less atrophy, so maybe it's better to use 5-FU. Let's go forwards. There's a study of combining triamcinolone and 5-FU as compared to just triamcinolone or 5-FU. Which one is better? The combination. So this is the reason, and I brought it from my clinic. It is always prepared in advance. What I do, they just reconstitute, okay, reconstitute 5-FU and triamcinolone on a ratio of 1:3. This is the basic. It's like for all my scars, especially, I would say, young surgical scar. In an old scar, if I have hypertrophic, usually I will go to 9:1. So more 5-FU and really very low amount of 5-FU. And another thing I would like you to see, can you take a picture? Okay. So you can see it's when it was prepared. And have a look. 5-FU, triamcinolone acetonide. What else do you see? Botox, all right? And hyaluronidase. Always I combine it together, you will have better result with hypertrophic scar if you treat it this way. Again, I will not get into the science. Maybe we'll do it later because it's too much in the sake of time, but this combination will provide better. So this is the what. Now let's talk about the injection. One thing that I have to show you, and actually it's like probably I will fire one of my assistants because she was supposed to come with a very small, I'm kidding, with small syringes. No, never mind. I'll just show you. Always when you inject into scar, you prepare it in such syringe, but you do not inject with such syringe. So if it's a very small hypertrophic scar, just use the BD 1 cc, okay? It has to be, you have to control the depth, okay, and the quantity. I will unfortunately do it with this one, but remember, this is not the syringe. So in my clinic, it is transferred to, let's say, 0.33 BD syringe or to 1 cc. This is one cue. The second one is the needle that is used. Again, you see, I still didn't talk about the laser. So what we do we have alcohol? This is alcohol? So can you open it? Good. All right. So I'm going here, I'm feeling the scar. Always palpate the skin to see if you have any area of more than 2 millimeters. There's nothing. So this one should not be injected. The second one. Okay, let's come here. I'm going all the way up. There is one here, and there is this area, okay? So what I do, again, not with this. Can you hold it like, it's okay? Is it okay like this? Okay, like this? Okay. So what I do, have a look at the needle, okay? It's a very small, just puncture, and I put drops of material. Very difficult to do it with this syringe, but you understand the concept. Small dots within the scar. It's good that I didn't go to the gym because to pass, it's nearly impossible. This is one, and the last one was here. All right. You see the bleb? All right? This is the end result. So this is one, okay? And you see the whitening. Have a look. You can see the whitening of this area and this area. That's it. It's enough, okay? Do not inject. I think one of the main problem that people inject too deep, so you inject the fat. Just insert the bevel, use syringe of 0.33 to 1, very short needle. So this is one. The second one, let's talk about the hybrid and let's talk about what we do. So in this one, we perform the DIVL. As you can see, this is actually atrophic. So I don't really feel any, okay, elevation. So if it's atrophic, we go towards more non-ablative, one. Second, we want, what about the density? High, and fluence will be low. So let's set the area. So have a look at the screen. Okay, I always start, you can go from the Oscar mode, but it doesn't really matter. So I would want more 1 to 3, okay? I want relatively low density, low power, and I want pulse duration to be high. I want more energy. And regarding, you can see if this is the first density, 5 on 5, 7 on 7, 9 on 9. I usually will use 4 or 5, even 5 or 6, but this is a demonstration and I don't follow the patient. You can even go higher. Regarding the pulse duration, the power and the pulse duration of the non-ablative, you can go high as 6. Let's go with 5. All right. Now, this is a very, relatively, we talk about, it's a small, very narrow scar, so you don't use to use. I will press the mini. I will decrease. All right. Let's go. Now, in last IMCAS, I realized that because I'm getting very old, with the camera and everything, I just don't see the treatment area. So this is, let's see how it works with this one. Okay. Perfect. Okay, let's take it up. Let's see that they see the treatment. Okay. So, and I just start.
Okay.
Is it painful?
She doesn't speak any English.
Okay, I just go over all the scar. It's very, very simple treatment. There is actually nothing to learn. Now, we're not going to do it in this side because we do not have exosomes or PRP, but just for you to know, because I will show you the same laser-assisted enhanced delivery in the other area, but here I will just do this treatment, and because it's actually atrophic in most of the parts of the scar, what I would do, I would use the impact, the sonophoresis, and what we will do, it's either to insert vitamin C or non-cross-linked HA, or PRP was mentioned, but that's what we use. We have different ingredients in my office. And again, you can see this is very easy to perform. And here, because it's aligned anyway, and you see that my pattern or my shape is a little bit larger than the scar, I will not do the feathering, but again, if it's more atrophic, wide scar, I do feathering like we did in Dubai, and you saw the treatment. So the surrounding tissue will be treated with the brush technique, same setting. Again, you just want to kind of obscure, to mask the borders between the scar and the normal tissue.
Ophir,
It's a game changer.
Ophir, we have a question from the audience. If you can repeat the mixture of injectables that you used.
If I can repeat
The mixture of the injectables you've used.
Yeah, triamcinolone acetonide, it's 40 milligram per milliliter. You take 1 cc. Then 5FU, it's 50 milligram per milliliter. You take 3 cc. Now you have 4 cc, okay? We add botulinum toxin. We add 30 units of botulinum toxin. I'm talking about Botox. Do the conversion if you use Dysport or Xeomin. I think it doesn't really matter, okay? And then what we do, we had the same amount. So we have approximately 5 cc. So we add another 5 cc of hyaluronidase, okay? The hyaluronidase is ready to begin with. We have, it depends which, you have the ampules of 1,500 unit, international unit. Okay, so I have it ready with 10 cc apart. It's ready if something happens and if I need, so it's ready in my clinic. So I just take 5 cc out of it. So, 750 units. Yeah. All right. So let's go to the, can you hold it? Let's go to the other side. And the other side, it's a little bit hypertrophic. So again, here I change my setting. So regarding the CO2, I will go higher. So I will use probably 50, between 50 to 60, but let's go 50. I will decrease the on time. I want less heat propagation. And regarding the non-ablative, again, I will reduce it to 3 and do 12. and I will reduce the density either to the second density or the third density. Let's see, it will be difficult for me here. Let's try from here. This is a problem, technical problem. Okay, let's take this one here. Okay. Perfect.
Ophir, I'm going to be challenging your multitasking and ask you questions in between the demos.
I don't know. I think because we came from here, we have to bring it to. All right. Ask me.
It's okay.
Yeah.
We have a question from the audience. If you think you can improve a scar of any age, for example, a scar of 10 years old?
I think yes, but again, I'm not sure it's a good question because any scar can be improved. But the question is, why? I had recently in the hospital, I had a patient, 94 years old patient, who came to me because I was being hosted on a TV show, and he saw me and said, all my life. So he came, he had a minor scar on his neck, really no one see it. And I told him, come on, you are 9. So again, it's not us to really judge our patient, but I think the treatment, you can improve any scar. However, the change will be tiny. So if it's a dramatic, widespread hypertrophic scar, of course you will have more change. I have always the same stupid joke. I probably would not be a comedian. So I'm telling, in Israel, do you have the lottery in your country? I believe so. So there is a lady, her name is Ariela, and she, whenever someone wins the lottery, she is calling him. She's like, you won the lottery. So I have the same metaphor. I'm telling him, look, try to think. This Ariela, this lady, she called you, she told you, you won the lottery, $100 million. And then she said, oops. My mistake, 50%. Still 50% of $100 million. It's a lot, right? Well, I would buy it. Now, let's think about the other scenario, okay? She would call you and said, dear Dr. Professor Artzi, you won 100, I don't know, baht. Where is the Thai people? Baht, or $100. So, I was mistaken, 50%. 50% of very, very tiny problem is a tiny change. Now, the cost, the effort, the adverse reaction, so you have to wait, okay? So somehow you have to understand when to treat and when not to treat, and I think it's our responsibility. So I say no to the patient. So if I think it doesn't have to be treated, I'm telling them, in my opinion, you should not treat it. The reason you want to treat now is, I don't know, but people cannot see. And if he or she are not convinced, usually I'm asking about the motives and what they really want to achieve. And if I can achieve it, I do something. But again, it's not every scar should be treated. Okay, so this is the first one. You can see the wavy pattern. Okay, I'm not sure you can see. And now we do the last phase of the treatment. So I switched it to the impact. Let's have the okay, no, it's okay. No, with this one. Okay, and what we do, this is the impact. It's a kind of, I would say primitive device, but amazing result. Use it for rejuvenation. Use it for scars, for any scar. If it's atrophic scars, PLLA, okay, it's a great solution. Insulin can be applied and can be pushed into the skin. If it's hypertrophic like this one, so this is the formulation. I told you what we do. You can see, maybe you will do it and I will do the treatment. Okay, let's see if it works. So just put drops on the area. You see, it's very easy to do it. And what I do, I first do the tapping. Okay, just tapping like this for like 10 seconds. And then I go with a circular motion. All right, let's carry on. Few drops.
Ophir, can you explain about the ratio you used on this hypertrophic scar, on the ratio between the 1570 and the CO2?
Yeah, I told you, it's like the rule of thumb, whenever I have more hypertrophy, I'm using more non-ablative, I'm increasing the density, if I have hypertrophic, I use, the ratio is usually less, more CO2, that's what I use, okay? And less non-ablative. Here, it's not really hypertrophic, so I didn't really change the pattern. I changed a little bit just the density. But if you have, let's say, really hypertrophic scar, severely hypertrophic scars, I will probably, what I would do, I will just go to the CO2. So I will go to the CO2, at least in the first treatment, and then let's carry on, let's do it all the way. And at least in the first treatment, and with successive treatment, I would add the component of non-ablative. In the beginning, it will be 3-to-1. It will be 3-to-1, okay, in the favor of ablative. And then with the flattening of the scar, I will go to 2-to-1, then 1-to-2. Okay, so this is the to-go. Was I clear? Yeah, okay. All right, I think we are done. Let's finish the last part here. All right, that's it. All right, now, last sentence, because we're out of time, about the post-treatment instruction. 3 days of Vaseline, just Vaseline. Or if you have any, I don't know, healing cream, that's okay. And then what we do, we just put either hydrocolloid dressing or silicone dressed in order to push and to kind of make a frame, so to create a frame. And you will see here, I don't know, it's like maybe we should try and send photos to the people like after 2 months of the case, so you can see the result after 2 months. The next treatment, I told you nowadays, this is the reason I really like that it was mentioned during the panel. Wait, not every month, every 2 months is really okay, unless if you separate the treatment, do the DiVL first, and then after 2-3 weeks, do the fractional laser, the hybrid. That's okay as well. It's up to you. So thank you so much. Was it painful? Yeah. Can you ask her? How do you say painful in Spanish? It was I, or it was good? Okay, it was good. She loved it. All right. So I think with this, we're going to conclude this long session. And enjoy your coffee, and we are going to be back in 20 minutes.